Welcome to another edition of Revive and Thrive. I'm your host, Joshua Blum, and this is episode number 20. And today's episode is brought to you by the letter T, and T stands for tension. We're going to be talking a little bit about things like musculoskeletal tension and how that affects you emotionally. This is a podcast all about burnout for physician fathers. And so for the last couple of months, we've been talking about the alphabet one letter at a time, A to Z, and each episode is going through a specific topic related to combating burnout in some small little way that you can do in your day-to-day life. The idea is that if you can take one little idea and run with it, then there may be a lot of things that you cannot do, that you cannot change, you cannot affect, leading to a sense of hopelessness, meaningless when it comes to your work. But there are things that you may be able to, in fact, do yourself that may make things a little bit better and give you a little bit more bandwidth. And so today's topic is one that we actually touched upon on the episode on posture, on P. It is one that is in some way review, but it is one that is probably bears repeating because things like neck, shoulder, and back pain are incredibly common. It probably has a lot to do with us being two-legged creatures as opposed to four. What we talked about in the episode on posture is, of course, how we sit and we stand and how that can become habitual. But today we're also going to be talking about aspects of why this happens and what you can do about it. So for this, it may actually help to break out your grants or your netters from medical school. So what we're actually talking about here is a couple of different parts of the body that are normally thought of as disparate. So we tend to divide up the human body into these different organ systems. And you may have even learned in medical school things in blocks: the musculoskeletal system, the nervous system, the GI system, and so forth. Now, in reality, of course, they're all connected. Yet our medical system is still sort of siloed in this way. Now, if you're an internist, if you're a family doctor, if you're a pediatrician, if you're a psychiatrist, you may tend to think more holistically about things. However, we do tend to break things up into organ systems, right? We're writing our notes. We have different organ systems that we may, in fact, break things up into, just for ease of understanding for ourselves, for organization. Of course, keep in mind that those divisions are man-made divisions. They're there to some degree, but on the other hand, the body's all connected. And so when we think about this particular topic is a great example of how that happens. And so by what I mean with that is that there are a number of muscle groups that serve to protect certain key and vulnerable parts of your body. So think about the muscles around your spine. Think about the ones around your neck. Think about your jaw muscles. Think about the ones around your internal organs. So what typically happens when we have a sort of stereotypical flinch response, we tend to round out our shoulders. We tend to want to orient the big, broad muscles of our back towards something that is threatening us. We tend to crunch in our head to our shoulders, tuck in our head down, pull our hands up in front of our head, and pull our knees into our chest. That's a sort of stereotypical fetal position, right? It's protective. If someone falls to the ground, they're getting kicked or attacked or something like that, it's often the position that they find themselves fending things off in, just because it tends to cover a lot of stuff. It covers your face. It tends to cover the internal organs, those kind of things like that. And so if any of you have a dog may notice that if your dog gets stressed, what happens to their head kind of goes down low, their ears go back. So it's not just in humans. We have that sort of shrugging action that happens when we get stressed too. Now, a lot of this can be exacerbated in certain positions, like if we're sitting and we're hunched over certain things, but this will happen all on its own. And but it doesn't necessarily mean that there has to be something that's stressful right in front of us, saber-toothed tiger attacking for whatever, something like that. It doesn't have to be quite as dramatic as that. Your body doesn't really know the difference. The fight or flight, the sympathetics will engage. If it's something that's sort of verbal, emotional, physical, whatever, it'll still engage. When those systems are engaged, a cascade of things happen. Of course, there's stress hormones and so forth that get engaged, but these muscles will tend to tense up. And if you think back, again, when the sympathetic response, one of the things that typically happens, in addition to things like your pupils will dilate and all these other kinds of things like that, typically we'll start to breathe faster. Our breaths typically get a lot shallower and quicker. So that's something that you can definitely see in the diaphragm. How are these things connected? Well, let's think about one of the big muscle groups that connects your lower body to your upper body, and that's the hip flexors. The hips are just an enormously complicated joint. It's one of those things that probably is the cause of some of our issues when it comes to back pain. One of the things that tends to happen when we're stressed is that the hip flexor group will be engaged. Now, the hip flexors do exactly, of course, like what they sound like they do. They flex the body at the hip, meaning that the legs are pulled up into the chest. And kind of in an evolutionary sense, this is protective, protect the body from harm, particularly those like your intestines and other internal organs. So what happens with that, though? If those muscles are chronically tense, and there's a couple of muscles that make up the hip flexor group. So the iliopsoas is one of them. And there's one part of the quadriceps, I believe, that is also a hip flexor. If you're wondering which muscle group is this is the muscle group that is engaged when you're sitting. It's also the muscle group that is engaged, or stretched rather, when you are doing a lunge or a lunge stretch. So at any rate, those muscles, the hip flexors, get engaged and they tend to tighten up. Now, muscles that get tight will, of course, loosen when they're not that way, right? But what happens if that doesn't really happen? What happens if the stresses continue to happen again and again and again, or they're just sort of there all the time? Well, those muscles tend to stay activated, right? Because the threat hasn't really gone away. Muscles that are tight typically don't get good blood flow. They get cranky. They're more prone to injury. Muscles get their power from basically elasticity. If you think about a rubber band or maybe a pair of pants that's been stretched too far and too long, what happens? It gets dry rotted and it snaps. It just doesn't really have the same elasticity to it. And our muscles are kind of like that. So if you think about a chronically overloaded muscle, like the hip flexors, this is where the anatomy part comes in. So those muscles are attached to the lower spine. And then what happens then is that if those muscles are tight, you have a bit of a tug of war going on. The lower spine gets pulled basically anteriorly and inferiorly, or basically just down. Your lower back and the muscles that are opposing the hip flexor group, they don't like that. And so that tug of war will start to occur, and the muscles in your posterior part of your body are going to pull backwards. And that typically is one of the causes of lower back pain. As that lumbar, that lower part of your spine, your body wants to prevent it from having excess lordosis, right? And so as a result, you have this tug of war. You may have also noticed this if you spend a lot of time sitting, particularly in certain unideal sitting positions or sitting surfaces, that when you get up, your lower back hurts. So the exact same thing will happen for that reason. Now, of course, if you have the two together, you're stressed and you're sitting a lot, you have the recipe for worse back pain. Let's just say you're stressed a lot and you're commuting a lot, you're stuck in a chair, or like it could be for us, commuting a lot, but it could also be you spend a lot of time stuck in a chair or a stool or some other surface, probably unideal sitting situation, say a clinic or something like that, writing notes. Often the computers and stuff like that, are the way they're oriented in most clinics, totally not very ergonomic and not very well set up for long periods of time that you may spend sitting at them. So, okay, all right, so the muscles are tight. So what happens when the iliopsoas gets tight, right? So interestingly enough, the iliopsoas actually shares the same fascia, the connective tissue, as the diaphragm. So the diaphragm we talked about before is being something that's going up and down, up and down, up and down, more rapidly and more shallowly than it might normally when people are stressed. So there's another thing that kind of adds to this, and that's the vagus nerve. And the vagus nerve actually runs right through the diaphragm. It starts in the brainstem and runs out, throughout much of your body. And so that will tend to pick up on this activity. Remember the vagus is kind of engages the sympathetics versus the parasympathetics. It's kind of like this thermostat for your body, right? And so it'll pick up on what's going on and then add to the whole thing in terms of furthering the stress response. Your body wants to keep itself safe, and so it'll do all these things in order to make that happen. That means that things that engage the parasympathetics, vagal stimulation maneuvers, for example, can actually help reverse some of this. Meaning that if you find ways of increasing parasympathetic tone in your body, you may actually find ways of inadvertently lessening tightness in areas of your body too. Now, that's one way of doing it. Another way of doing it is simply by stretching out those areas that are tight. So areas that are often going to be tight are the hip flexors and areas around there, all that whole group there. The lower back muscles, you may notice some tightness in the trapezius and other shoulder areas. And spending some time stretching those areas out, increasing blood flow to those areas. So if you know anybody that does good massages, this is a great opportunity to ask them to help you with that. If any of your spouses, for example, can help you with a massage, or if you don't have anybody that knows how to do one or feels comfortable doing one, you can actually do it yourself. One way is to actually take a ball, kind of like a tennis ball or a street hockey ball, something that is hard and not too squishy, and put it against a wall or put it against the floor, and then find the tender spot in, say, your back or your shoulders, and then place your body directly on it and then start to roll around. You may notice in about 10 to 15 seconds that the area does not hurt quite as much anymore. And so that's a way to gently stretch that area. It goes by a name called myofascial release, but whatever you call it, it's basically like a gentle massage that you can do yourself. You can basically also do it kind of with your hand, but it's a little awkward to do it, and you may not be able to do it quite as easily. But if you don't have anything else, your fist can also serve as the same thing. The other thing, of course, is anything you do that gets your body moving will increase blood flow. And so that's one of the reasons why it's important when you've been sitting for long periods of time to get up every now and then and to move around and change positions. And so, for example, if you're standing a lot, then it may be a good idea to walk around or go sit. If you've been sitting around, you may find it helpful to stand and then again move around. It's a little bit like when you stop for a long drive and you get up and move around because you're feeling tired and you want to wake yourself up. The action of just moving around is helpful because it helps to activate your nervous system and increase your focus, and it also helps to prevent some of this tightness that we're talking about. So when we think about when we tend to burn out, we often think of it as a mental thing, a sense of hopelessness, a sense of meaningless in what we do. And of course it's that, but it's also often a conglomeration of other things in our life too. What we're trying to do is reduce things that might affect our overall bandwidth. And chronic pain is definitely one of those things. If you talk to anybody who deals with any kind of chronic pain, particularly in areas in your midline, so neck, shoulders, lower back, those are just so common. When you cannot move those areas very well, you feel old. You feel like you cannot do things the way you would normally like to do. It's hard to find a comfortable position. It may be hard to sit, it may be hard to stand, it may be hard to lie down, and that gets tiring very fast. And when you are noticing that your work directly causes more pain, maybe it's because you have to sit, maybe because you have to stand excessively, maybe it's because you have a lot of stress that you don't know how to necessarily deal with, then it feels like a vicious cycle. You don't know really. It's a chicken or egg kind of thing, but you got to start somewhere, right? So one way to start would be to do things that work on the muscles, either getting more blood flow there, including just increasing activity, cardiovascular, or just movement in general. It could be strength-based. It's really just movement, getting good blood flow to those areas and stretching them out. If you need to go see a physical therapist, it often can be very helpful because they can do an assessment for you and tell you this muscle group is strong, this muscle group is relatively weak, these muscles need to be strengthened, these muscles need to be stretched, and so forth, and can help guide you in what to do. We don't have to do everything. Many of us were trained in these areas, but it's not really necessarily totally our thing. We may not do it full time, and so you don't have to know everything. Outsource it, go see somebody that can help you, and it may be very helpful. So I'll leave you with that. I would say any kind of activity to these areas often is helpful. Look for ways to change your position. Look for ways to change movement during the day if you're not able to do that. Look for ways to add things like massage into your life if it's helpful. And you may find that you are able to feel better, and then the mental side of things will also come around as well. So something to play around with, something to experiment with, and potentially something, if you see lots of patients who are also dealing with the same thing, then it may be something to share with your patients as well. So thank you for listening and have a great weekend.